Hi, my name is Renee Augsburger, and I'm here today to tell you a little bit about osteoporosis and just speak briefly about osteoporosis post-stroke. So let's start with first quickly defining what osteoporosis is. And osteoporosis is a disease. It's a disease that causes your bones to be weak and brittle. It causes the bone to be very porous. And because the bone is porous, it can result in fractures from even the simplest trauma. So osteoporosis is a serious problem and it is very common. In fact, 70% of the people over the age of 65 may not even know if they have osteoporosis because they have never had any kind of formal testing to determine if they have the disease or not. Osteoporosis is responsible for 2 million broken bones a year. Osteoporosis is also very silent. It is a silent disease and it can sneak up on you. One of the first signs that you may have osteoporosis is that you break a bone. Or another sign could be is that you notice yourself getting shorter, and maybe not only shorter, but that you start noticing a little bit of curvature in your upper back. So the good news is that the bones are alive and your bones remodel themselves about every 7 to 10 years. So the old bone is being removed and the new bone is being replaced. However, as you get a little bit older, the new bone is replaced at a little bit of a slower rate. So you end up really with more old bone than new bone as you get older. And that's what helps, not helps, but that's what contributes to osteoporosis. So there are risk factors associated with osteoporosis. There are some things in life that you can change and improve yourself upon. And then there are other things that you really just shouldn't change, can't change, have a hard time changing. So first of all, let's go over those things that are difficult to change or that you can't change. So first of all is your gender. Women are at a much increased risk for osteoporosis, especially after menopause. When the estrogen levels drop, your risk for osteoporosis increases as well. There are also many more women that have osteoporosis at a younger age compared to men. The other thing you cannot change is your heredity. Did you inherit the disease from your parents? You do have an increased risk if you have a family history of osteoporosis. Age you cannot change. The older you get, it also increases your risk. And there are certain medical conditions and medications that also increase your risk of osteoporosis. We'll touch on those in just a minute. However, let's get to things that you can change. We're going to mention them now. We'll talk them a little bit more in depth here in a second. So you can increase your consumption of calcium. You can increase your vitamin D intake. You can quit smoking. You can limit the alcohol that you drink. You can also increase your physical activity, and especially those activities that are weight-bearing exercises. This one you don't hear very often, but low body weight actually increases osteoporosis. So if your BMI is less than 20%, that increases your risk for osteoporosis. So actually gaining weight to a certain extent reduces your risk. And then of course, some medications, again, you may be able to change, but of course you'd always want to consult with your physician before you did that. So there are some medical conditions that put you at an increased risk for bone loss. There's quite a few of them. We'll just talk real quickly about a few more common conditions, and some of those would be like your autoimmune disorders, rheumatoid arthritis, endocrine disorders such as thyroid, hyperthyroidism, Cushing's disease. There are certain cancers that increase your risk, and some neurological conditions like stroke and Parkinson's disease, some mental illnesses like eating disorders, just to name a few. There are medications that also can cause bone loss. This is not a complete list, but it's always good to consult with your physician again. Probably some of the more common medications would be one that are taken for the endocrine disorders, for thyroid disorders, such as Synthroid. Another common would be anything in the steroid family, example, prednisone, many of the cancer drugs. So again, always consult with your physician regarding your medications. So if you've had a stroke, it's important to understand what causes the bone loss in stroke and understand that it is a little bit more prevalent. You do have an increase in osteoporosis if you've had a stroke, and that increase is predominantly in your affected side. So there's a lot of factors that contribute to this, but it seems like the factor that has the biggest impact on osteoporosis post-stroke is really the reduced mobility that you may have post-stroke. So if you're in bed and you're not walking as much, or maybe you have a splint on your arm or on your foot, you're probably not using that arm or leg as much as you did. So that is the biggest factor in contributing to the bone loss. Another topic of discussion for this is also the loss of the normal amount of vitamin D that you may normally get, because after you have a stroke, you may not live in the same place that you did before, or you may not be outside in the sunshine taking walks as frequently as you did before as well. So the decrease in vitamin D could also be a factor. This is a graphic that just gives you a little idea of how much bone loss and where you can expect it. Again, it's primarily in the affected side, and you can see in the arm, it's about a 17% increase in bone loss. And then in the leg, it runs anywhere between leg and hip. It runs between 9 and 12%. Again, it is predominantly in the affected side. It also puts you at a bit of an increased risk for a hip fracture, because post-stroke, people are more likely to fall just because of balance issues. And then you put that on top of decreased bone density, it does put the risk of a hip fracture at a higher percentage. So how do you know if you have osteoporosis? And one of the things that you can do is you can ask your doctor if a bone density scan is right for you. So it is called a DEXA test. It is not invasive. It is quick, simple, takes about 15 minutes, and they scan your body and they give you measurements of your bone density, and they'll give you different measurements for different parts of your body. In the end, you'll come up with a T-score, and this T-score will give you an overall indication of what your bone density is like. So it's going to give you a score of maybe normal, or maybe a mild bone loss, or it may give you a score that indicates that you do have osteoporosis. So what can you do to prevent bone loss and improve your overall bone health? So we'll go back to what we mentioned before, and let's talk about calcium, because calcium is the principal mineral of the bone. And every day we lose calcium, and so we need to help our body replenish that. And the best way to get calcium absorbed directly into our bones is from the food that we eat. So we need to have at least 3 to 4 servings a day of calcium-rich food. The recommended daily allowance is between 1,000 and 1,200 milligrams. Again, it is important to get the calcium from food versus supplements. There is a bit of controversy on whether supplements are really effective, and they should not be used as your primary source of calcium. If you're not sure how much calcium you're getting, you can look up food labels and it will help give you an indication of the calcium intake you have for the food that you're eating. If you look at the nutrition facts or the nutrition label and look under calcium, you'll see a percentage. So this example, it says 20%. If you add a 0 to that, it will tell you that this item for the 1 serving is providing 200 milligrams of calcium. So that's a little cheap for you. One of the other things that you can do is just increase your vitamin D. And the best place to get vitamin D is outside in the sunshine. And sometimes it's difficult, depending upon where you live, to get enough vitamin D outside. And so you have to get an additional intake through some food. It's hard to get all the vitamin D you need in through food. Some of the foods that are higher in vitamin D are like tuna and salmon, and there is vitamin D added to some food as well. But there is significant research that supports the use of supplements to get your full dosage of vitamin D that you need. Again, this is a good discussion with your physician to ask him how much vitamin D and how much in a supplement he recommends for you daily. So another thing that you can do, we talked about calcium, we talked about vitamin D. Let's talk about exercise now. Exercise is one of the best ways to improve your bone health and to prevent bone loss, but not all exercises are equal. And so bones like a load. They like exercises that offer impact. It's kind of like the bones like the surprise of when you hit the ground. So exercises like dancing, running, stairs, tennis, things that offer a big impact are most effective. Now, that's hard sometimes as you get older, and especially if you have had some kind of condition like a stroke. So alternatives to that are lower impact exercises. For example, walking, but you're going to try to walk just a little bit faster so you get a little impact as with every step that you take. So you're trying to add some velocity to your walking. Other things are going up and down stairs, maybe trying some dance or maybe something like a Zumba class or something. I know that sometimes those are hard to keep up with. At TR Care, we know that getting weight through the joints is difficult, and especially if you've had a stroke. So we do design exercises, not only for people that have had stroke, but for everybody to help get weight through your joints, to help get weight bearing through the bones, to help with that bone health. This is just an image of some of the exercises that we offer for improving bone density. Some of the other exercises besides impact that are good for you are exercises that incorporate maybe exercise bands or weight, and really address posture and strength to the lower extremities. So it's important to address posture because as you get older, and especially with osteoporosis, you start rounding that upper spine. So you want to strengthen the muscles of the back and the front, of course, the muscles that hold you upright and that support you. That will decrease your risk for any kind of vertebral fracture too. The reason that you want to strengthen the legs is to reduce your risk of falls. So if your legs are stronger, then your risk of fall is less. So even if you do have some osteoporosis, not landing down on the ground is always a good first start in prevention. So there are a couple activities. Like I said, all exercise is not equal. There are a couple activities that really just are not great for bone density. Two of these are swimming and biking. They do not provide any weight bearing through the bones. They do not provide any impact. While these are great exercises for other conditions, they do not provide the most benefit for preventing osteoporosis. So just kind of a few reminders here is that you need to get vitamin D every day and your calcium. So get vitamin D if you can by going outside. And then you also get the extra benefit of getting outside on a walk. Remember, try to walk a little bit faster. Do your weight bearing exercises every day. Try not to forget those ones for posture and lower body strengthening. Know your risk for fractures and talk to your physician about possibly getting a scan to know what your bone density risk is. And then lastly, make sure that you get your vision checked every year to reduce your risk of fall, and then eliminate your environment of clutter, again, to reduce the risk of fall. As we finish here, this is really beyond the scope of our discussion today, but I did want you to know that there are medications that are FDA approved and have been shown effective for the treatment of osteoporosis. I've made just a small list over here for your reference, but again, this is a good discussion for you to have with your physician. So thank you for joining me today. I hope you learned something, and come visit us at our TR Care website.